As more and more vulnerable seniors die from COVID-19, the Fraser Health Authority has still failed to fully implement the government's plan to protect them. CTV's Michelle Bernoro tells us how Fraser Health, facing staff shortages, is still allowing care aides to work in multiple facilities weeks after the province ordered them to stop.
85-year-old Rose LaRue needs the help of care aides twice a day.
The care aides in Fraser Health are all very nice ladies, and they do the best they can with what they've got.
And yet she was relieved when the Langley retirement community she lives in banned Fraser Health care aides and took over her care.
We knew that they were going to very many places, to several places in a day, and they'd come back here, and it wasn't safe. I didn't feel safe.
Despite an order from Dr. Bonnie Henry in March, Fraser Health has not finalized a plan that prevents care aides from working at more than one facility unless there is an outbreak of COVID-19. Fraser Health could not tell us how many care aides are still working at multiple sites, but in an interview on CTV News, the health minister says the single site restriction is a complex issue.
Do I want it to be faster? You bet I do, but we're getting it done with great speed.
However, this isn't the only issue raising alarm bells. A Fraser Health protocol says care workers who have contact with someone who is COVID-19 positive should tell their boss and report for work if they aren't showing symptoms.
If they know they've been exposed to someone with COVID-19, reporting to the supervisor and then returning to work just seems like a ludicrous policy.
They're not symptomatic, so the risk of transmission is extremely low in the first place. And we put additional measures in place in those situations where they would be wearing a mask, they would be doing their hand washing very regularly.
Fraser Health, which announced new infections linked to 3 facilities Wednesday, says while the first choice is to quarantine the employee, that can lead to risks associated with inadequate staffing. The worries over Fraser Health policy don't stop there. A leader at a care home in the region who did not want to be identified told CTV that she's concerned that staff no longer have to self-screen their temperature. As for Rose, she says it's taking too long to stop workers from traveling to multiple sites.
I feel sorry for the people that they're serving now, putting them at risk.
Michelle Bernoro, CTV News, Langley.